Welcome to the fourth quarter webinar series. My name is Liz McGuire, and I'm an account manager at Cornerstone. Today, we are joined by Anthem Ohio to talk about their 2026 product portfolio. Before we get started, I'll go over a little housekeeping. If you have any questions throughout the webinar, please feel free to leave them in the Q&A box, and we will address them at the end of the presentation. My information is on the screen if you would like to contact me. Also, if you haven't done so already, please be sure to subscribe to our email list to receive the weekly Monday Minute newsletter, which has the latest Cornerstone, carrier, and industry updates. Now let's welcome Anthem Ohio's Kathy Shiplett. Take it away, Kathy.
Thanks, Liz. Let me start sharing my screen here. While we're getting this set up, I just want to say thank you to everyone for joining us today. We want to take you through the 2026 updates on our products. Hold on a second. I'm having a little bit of trouble here. Okay, let me try that again. And okay, I think we're set. Can you see everything okay?
Yep.
Here we go. Okay, well, so let's get started. Oh, and I do want to mention that I have with me today presenting as well, Ali Ciccone, the sales rep in the Central Ohio, and Robin Kaup, the account manager for Southern and Toledo currently at this time. So the three of us will be bringing you the roadshow information today. Anthem offers 4 essential tools to keep you informed and plugged in. We have our producer toolbox for you to manage your book of business. The Broker Plus mobile app is also available to download on Android or Apple for you to keep connected to the producer toolbox when you're away from your computer. And we do continue to make enhancements on all of our tools to make your experience working with Anthem better. A marketing piece that we had requested, and we hope that you find helpful in your conversations with clients, is this piece that outlines where do your healthcare premiums go. This piece helps break down the math behind the premiums, which we all know can be kind of complicated. Some of the key takeaways on this slide are that 83.6 cents of every dollar go to covering medical services, and that prescription drugs are the most costly component of health insurance, and it surpasses both inpatient and outpatient hospital costs. A copy of this marketing piece will be available in the handouts at the end of the presentation. You will be receiving some additional information, but it's also available on anthembrokerhub.com. That's where we house all of our marketing materials. So the plan grids, product guides, producer guides, marketing materials such as this piece. That is all housed on anthembrokerhub.com. Broker and industry education is made available to you in a few different ways. We have a quarterly email that is sent with links to recent articles and webinars. That email series is sent to licensed and appointed agents. That's where they pull the distribution list directly from our licensing system. And then on the anthembrokerhub.com, like I just mentioned, we have trends and insights page that outlines educational resources, the latest news, and webinars. And we do annually offer a webinar series of short deep dives into some of Anthem's core products and offerings. For 2026, we are introducing 2 new products that balance the needs of employers and members by linking our network strength, innovative provider partnerships, transparent plan designs, and unique digital tools in a simple, intuitive, and guided healthcare experience. Healthcare can be complicated, expensive, and hard to navigate, resulting in people putting off care, making uneducated decisions, or not getting the care that they need. And it's time for a more flexible building block style healthcare solution. This portfolio of plans transforms how people access and experience care with options that offer copay only plans with price transparency and unique models that combine virtual and in-person care. We need a different approach to healthcare, one that is designed around clarity and choice and lowers costs for both employers and employees. Each of our alternative health plans utilize a new simplified Sydney and Anthem.com experience that provides streamlined and intuitive access to the most utilized capabilities, supporting informed decision-making, managing healthcare benefits and claims, and providing virtual care options aimed at enhancing the quality of and convenience of healthcare access. This experience will still offer everything the Sydney Health app has today, just with a streamlined experience so that the members can easily navigate and complete their health tasks. Clear Choice is Anthem's full-featured alternative health plan that combines all copay design with preferred copays for office services provided by a designated Anthem Diamond provider. It offers robust member support, a refined digital experience that helps empower members to control their cost. The Clear Choice plans will be offered on our SACA benefit plan and Anthem balanced funding portfolios. Across our markets and providers, cost, quality, and experience can vary. Anthem, with the quality, cost, and appropriateness of care criteria, has been able to determine a group of high-performing providers known as Anthem Diamond providers. These providers offer high-quality, low-cost medical service, resulting in reduced medical trends, improved health outcomes, and an enhanced member experience. Diamond providers will prominently be displayed for an Anthem Diamond provider designation in the Find Care for members enrolled in a medical plan with a benefit differential for PCP or specialist visit. There's a personalized match recommendation in the Find Care that will give weight and preferential treatment in the sorting for the Anthem Diamond providers. And I do want to point out that not all providers within a provider's office will be receiving the same designation. So, for example, you might have Dr. Griffith that is designated a Diamond provider in the Mayberry primary care office, but his peer, Dr. Fife, may not have that same designation. So it is at the provider level and not at the office level. Clear Choice products offer a few unique plan design features. The copay design helps members understand their out-of-pocket costs before receiving the care. The lower copays for Diamond providers encourage members to work with providers historically proven to provide high quality, appropriate, and cost-effective care. The simplified digital experience is included as well. And members under the age of 19 have a $0 copay for primary care and behavioral health office visits with any in-network primary care or behavioral health provider for Clear Choice. And since the new state mandates require that physical therapy and occupational therapy, chiropractic services be provided at the same PCP cost share, that means that PT, OT, chiro services for kids under 19 will also be covered in full under the Clear Choice plans. Virtual Access Plus, this is our second type of plan design that we are rolling out for 2026. Virtual Access Plus includes features of the alternative health plans, such as the copay design and $0 copay for virtual primary care visits. Also includes the refined digital experience and the robust member support to empower members to control their costs. There are HSA compliant designs with the Virtual Access Plus, and they would work. The way it would work is that the deductible is met before all services except for the preventive care. We have designated some of our existing plans that are offered currently on the SACA benefit plan, Ohio Farm Bureau, the Anthem Balance Funding portfolios as Virtual Access Plus plans. So they will now be included. They will now include the refined Sydney experience and offer. They will be considered the alternative health plans. This chart provides a visual of our two new plan designs for our alternative health plans. Both the Clear Choice and the Virtual Access are copay based plans. Clear Choice offers lower copays for primary care and specialists with an Anthem Diamond designation. Another benefit of the Clear Choice plans is no copay for the pediatric primary care and behavioral health visits. Both of our new plan designs will have no cost virtual care for online providers and participating PCPs. They include our simplified Sydney experience, as well as the Engagement 200 package, Smart Shopper, and EAP, which I'm going to tell you about next. We are excited to announce that we are adding an Anthem Employee Assistance Program to our small group plans for 2026. This will occur at renewal for existing business and at enrollment for groups beginning January 1. The EAP is being added for SACA MIWA, Ohio Farm Bureau, and Anthem Balance Funding plans. The grandmother groups will not have this enhancement, but they will continue to have the option of purchasing a standalone EAP plan as they do today. An EAP plan provides access to resources, tools, and information to help employees manage their many work and personal responsibilities. Employees want more, and meeting their concerns is critical to attracting and retaining talent. Two items that I do want to highlight is that the EAP plan provides 3 counseling visits, either in person or virtually, per employee or household member per issue. Legal and financial consultations are also provided up to 30 minutes per issue per benefit period. And now I'm going to turn it over to Allie Ciccone, and she's going to take us through some additional medical plan changes.
Thanks, Kathy. Let's take a look at our 2026 plan changes for our small group portfolio. We have some big changes and exciting highlights for 2026. Kathy told us all about our alternative health plans to offer members more transparent, cost-effective options. With the addition of these new and reimagined plans, our Blue Connection HMO plans will be discontinued in 2026. In the next slides, we'll look at cost share adjustments, some due to regulatory requirements and some to enhance the affordability of our plans. We'll have changes to our Preventive RX drug list, now called Preventive RX Basic Plus. And effective 1/1/26, K-Health will no longer be a participating provider. However, members will still have full access to virtual primary care services through Live Health Online. I think we're back a few slides, maybe, Kathy.
Uh-oh.
Sorry. That's okay.
Where are we
I think
going
2
here?
more still.
Is that right?
You're going.
I think we're going
You're
forward
going
instead of
forward.
backwards. Yeah.
Yeah.
Oh, I thought that's what, I'm so sorry. Okay.
That's okay. Giving everybody a good
I'm sorry,
preview of what's
everyone.
to come.
Tell me what slide number you need.
Now we can go, I think, forward 1. Here we go.
Okay.
I'm sorry, back 1 more, I think. And then we're perfect. Okay, well, we'll just go from here. So we'll see some cost share adjustments that are being made across all portfolios here. So you'll see this is kind of a repeat across a few different platforms. But we'll look at SACA here specifically. So you'll notice that on a few of our plans, we'll have minimum deductible for HSA plans will be increasing to reflect IRS guidelines, as well as the out-of-pocket maximum. Breast cancer and cervical cancer screenings will now be covered as a preventive care benefit. And again, text-based chat through K-Health is being sunsetted, but members will still have access to online care through Live Health Online. To keep plans as competitive as possible, some plans will have increased cost sharing for emergency room, ambulance, and office surgery, OFFX RX copays, as well as increased Tier 4 copays at Level 1 and Level 2 pharmacies. The copay-centric plans that will now be Clear Choice plans will have tiered copays, which will be lower for Anthem Diamond providers. And as Kathy mentioned, we're very excited that all SACA plans will now have embedded EAP starting in 2026. This is a great reference guide. We always mention kind of holding on to this or referring back to it when you get questions on any of our portfolios. This one is specific to SACA. You can see here that the SACA plan utilizes the Blue Access Network for medical, the Choice Network for pharmacy. It includes our Foundational Wellbeing Solutions package, offers Engagement 200, Smart Shopper, and now includes EAP Basic. And again, just a great quick guide to refer back to, especially when you're doing your busy 1-1 shopping. In addition to our Clear Choice plans, we're adding a few more plans to our SACA portfolio, including some with 50% coinsurance. We will be discontinuing all Blue Connection HMO plans. Our Blue Access Options plans, or our 3-tiered plans, will be renew only and cannot be sold for a new group. On the next few slides, you'll see additions or changes to the existing portfolio to reflect Clear Choice and Virtual Access Plus plans. Please note the tiered PCP and specialist visits for our Diamond providers on our Clear Choice plans. All rebranded Virtual Access plans will be designated with the Virtual Access Plus in the plan name. Plans reflect the increased $50 copay for Tier 4 prescriptions at Level 1 and Level 2 pharmacies. And you'll see all those changes in bold. I'm sorry, in red. And lastly, some additional Virtual Access Plus plans with those same changes on Tier 4 pharmacy and the increased out-of-pocket maximums. Now let's take a look at our Farm Bureau portfolio. These would be for policy numbers beginning with SQ. Some similar portfolio changes we reviewed earlier are applying to Farm Bureau as well, such as the minimum deductible for HSA plans increasing, as well as the maximum allowed for out-of-pocket per IRS guidelines. The out-of-network non-emergency and air ambulance services will have no benefit limit, and those breast cancer and cervical cancer screenings will be treated as preventive care. Some additional specific updates for Ohio Farm Bureau are increased office RX copays will be increasing from $400 a visit to $500 a visit. For plans with RX copays, for Tier 3 copays, there will be an increase from $85 to $95. And for Tier 4 copays, there will be a $500 copay. As with some of our other portfolios, EAP will now be embedded with Ohio Farm Bureau as well. Another big piece to note is that the membership dues for Ohio Farm Bureau starting December 1st for new and existing groups will increase from $7 per employee per month to $9 per employee per month. The Ohio Farm Bureau membership grants membership access to all enrolled employees, not just the business themselves. Communication will be sent from miwa.io to groups, one going out in early October and another reminder going out in November before this change is being taken place. Again, this is a great reference guide for a specific Ohio Farm Bureau portfolio. Again, like SACA, we have our Blue Access PPO for our medical network. We have the base network for pharmacy with the essential formulary. We have our foundational well-being solutions, which includes Smart Shopper. We have diabetes prevention programs and more. Here you'll see the Virtual Access Plus plans rebranded to include the plan names, along with those RX changes we went over earlier. Next up, we'll look at our Anthem Balanced Funded Benefit changes and highlights. These will be with policy numbers beginning with E. Some of the portfolio changes we reviewed previously will apply to ABF as well, including increases to minimum deductible for HSAs, plans, and maximum allowed out-of-pocket per IRS guidelines. The text-based chat and live videos through K-Health will be sunsetted, and again, members will still have access to online resources through Live Health Online. Similar to our MEWA plans, you'll see increased cost sharing for emergency room, ambulance, office surgery, and office RX copays, as well as Tier 4 copays at Level 1 and Level 2 pharmacies. Clear Choice and Virtual Access Plus plans will be available through ABF, which offer a simplified Sydney experience. Again, EAP is now embedded for all of our ABF plans as well for 2026. Next up is that great snapshot that gives you kind of an overview of the portfolio details. You'll notice that ABF really mirrors our SACA plans. Included is our medical network, pharmacy network, as well as our wellbeing solutions package. In this plan is included Smart Shopper, diabetes preventive outreach, and again, EAP basic. Something we're very excited for in 2026 is having our ABF plans really mirror the SACA portfolio, making it easier than ever to quote and enroll groups on our level funded product. So in the next few slides, you'll kind of see an addition of a lot of plans, but again, that's really to make sure that our SACA plans and our ABF plans are matching up pretty similarly, making it easy to quote and enroll groups. So on this slide, you'll see the addition of the Clear Choice and Virtual Access Plus plans, along with those portfolio changes that we had just gone over. New plans are in bold, which includes all the plans on this slide, again, to match up our portfolio with our SACA portfolio. And I think in the last slide here, you will see the addition of our Virtual Access Plus plans to be included in the ABF portfolio. Next up, we will take a look at our ACA benefit changes. I'm sure you're sensing a theme here. So a lot of these portfolio updates that we looked at for SACA, OFB, and ABF are being applied to ACA as well, including changes to the minimum deductible, maximum out-of-pocket, breast cancer and cervical cancer screenings are being covered under preventive care. Those are all changes we touched upon earlier, but want to make sure you know it applies to ACA as well. Some specific changes to the ACA plans. In 2025, some HSA plans applied coinsurance after the deductible for certain benefits. For HSA plans in 2026, all benefits apply copays or are covered in full after the deductible. There will also be some copay adjustments on our HSA plans with copays. Next up, we'll take a look at the snapshot of our ACA portfolio details. We have 11 PPO plan and HSA compatible plans. ACA also has our wonderful foundational well-being solutions package, access to Smart Shopper, and as of 2026, EAP will now be embedded. With our SACA portfolio, we are discontinuing our Blue Connection HMO plans for 2026, and we are also removing the above silver plan. Lastly, for this section, we will look at changes to our legacy and grandmother portfolio. Once again, a lot of the same portfolio-wide changes are being applied to legacy and grandmother here, including breast and cervical cancer screenings and related services being covered as preventive care benefits. An additional and exciting piece to note is that our LARC Diabetes Prevention Program is now included for 2026 with our legacy and grandmothered plans. Next, we'll take a look at the plans we are discontinuing for legacy grandmothered for 2026. The removal of these plans listed here is just due to lack of enrollment. On our legacy plans, dependents age 26 will no longer be offered an extension of coverage to age 28. This does not apply to 26 to 28-year-olds that are currently enrolled. This will not impact dissembled dependents. Next up, we're going to take a quick look at our Wellbeing Solution resources and updates. Our small group Wellbeing Solutions program, called our foundational program, offers a ton of great benefits. Through the Sydney Health app, members have access to emotional well-being resources, 24/7 nurse line, and more. The foundational package includes condition management, such as Building Healthy Families, our program that offers support from preconception through early childhood, and our condition care program that offers support for conditions such as asthma, diabetes, and COPD. As you know, our Engagement 200 package allows members to earn up to $200 when they engage in their plan. We have some new incentives and have increased the time allowed for preventive exams. It was previously 90 days, which we've now increased to 120 days. Members can earn rewards for things as simple as logging into their Anthem account or their Sydney Health app. They can earn $20 per year or $5 per quarter. For participating in condition care programs, they can earn up to $50. So a lot of simple ways to really incentivize members to get more involved in their health plan. We do have a quick pharmacy update that we'll look at in the next slide. We have specific preventive RX plans, and they have that preventive RX in the name of the plan themselves. And on these plans, our Preventive RX Basic is now going to be called Preventive RX Basic Plus. It will include the same drug categories as Preventive RX Plus list, but it will exclude all brand name drugs, so only generics are included, with the exception of insulin where there is not a generic equivalent. And a listing of these updated medications will be sent to you along with the rest of the presentation materials after this. And I think I am handing it off to Robin to take us through our specialty.
All right, let's start with our specialty. Anthem Connect directly supports brokers handling specialty business with 2 to 50 employees. Chelsea Hardy oversees new business and upsells, and Brooke Bolanek handles the renewals. And they're listed here on the screen. They will collaborate with us, the medical team, to provide quotes and support you on your specialty benefits. Now let's explore Anthem Vision. We're starting today with an overview of the Blueview Vision Network featuring our 43,000 providers and 29,000 locations with strong network discounts and high utilization rates. Anthem offers a balanced mix of independent providers and retail networks to support your group's vision needs. Value-added benefits include discounting on multiple glasses, lens options, and laser surgery, plus discounts on prescription eye drops for myopia and other eye conditions. There are no changes or plan design removals for vision for 2026. New business vision rates have decreased by 1%, and renewals will see no increases. Let's dive into Anthem Dental. Anthem's dental network offers extensive provider coverage with significant member discounts and utilization compared to competitors. 610,000 providers nationwide with over 14,000 plus locations in Ohio alone. Our network is 37% greater than Delta PPO in Ohio. Here are some impressive statistics highlighting the benefits of integrating dental and healthcare through our whole health connection. The findings demonstrate enhanced health outcomes and cost savings achieved by incorporating dental plans with overall health. For 2026 updates, our small group dental plans are minimum renewal increases for new business renewals, and new options are added. These new plans offer no implant coverage and amalgam filling coverage to reduce the premiums to help out the groups cost-wise. They include the same carryover and additional value-added benefits as our essential choice plans. Please make sure that you share these specific exclusions when speaking with your small groups about the options. We also have an update on the summaries. The dental summaries are now available at the same link as the medical summaries for easy use. Our ACA and ABF business offering bundle discounts are available for both dental and vision when elected together. These coverages include a 24-month rate guarantee. It is also important to note that regardless of when dental and vision are added, even if it's off cycle, we will automatically line them up with the ancillary renewal and medical renewal date. Dental and vision offer up to a 2% discount added to your small group's Anthem balance funding. So 1.5 for dental, 0.5% for vision, for a total of 2% if added together. And then finally, here is the potential savings by adding non-voluntary specialty coverage to your SACA benefit medical plan. As shown, a group of 20 can save as much as to $6,000, while a small group of 2 can save up to $500 by just including dental and vision coverage in the SACA benefit plan. This credit is based on the medical subscriber number at the time the specialty is added, not the members enrolling in ancillary. As a reminder, Anthem does not require employer contributions on our non-voluntary dental and vision plans. We are solely a participation based. If the group meets 50% participation of the net eligible employees, the employer can contribute as little or as much as they would like. The group can get the non-voluntary rates and credits, and then they will not have waiting periods for major services. So GeoBlue, the global health solution of Blue Cross Blue Shield. If you have groups that have extensive travel, this is a great option for them. You can register to sell in Ohio with this live link, and it just gives you strength. One thing that it does definitely relieves the stress of knowing if your medical needs are taken care of when traveling. Here's a comparison of our core program versus the GeoBlue and what it covers. The one thing I want to mention is the homeward carriage of anything when you're overseas, but it's a great comparison to show what the need is for GeoBlue when traveling. Quoting and enrolling. Before I start on this, I was just going to let you know, the MIWA renewals have been released. I'm sure some of you have seen those. They're starting to, come out from your account managers at Cornerstone. And our average MIWA renewal is about 11.9%. And then Ohio Farm Bureau is about 14.7%. And these are without any demographics. And of course, it's an average. And then our grandmother should be released with ACA, hopefully in the next week. So just wanted to make sure, continue to work with your broker advisors on getting those renewals tied up as soon as possible. So we're going to talk about small group quoting in regards to MIWA and Ohio Farm Bureau MIWAs. There is a census underwriting option of groups with 10 plus enrolled. On small group 2 to 9, we still require applications, and all MIWA quoting is done on the producer toolbox. And all of your quote requests do require the employer questionnaire. Sorry, my voice is going out. Anthem balance funded for 10 plus enrolled employees. It has to be at least 10, obviously, to quote Anthem balance funded. Recommended for current level funded groups. So you can bypass the MEWA if a group is currently level funded with another carrier coming directly to, you would share your information, send it directly to Kathy if she is your new business rep, or Allie, or Nancy. So whoever your new business rep is, that is who you need to share your information, but always work through your benefit advisors on that. But those are our new business folks. Census underwriting can also be used, same as your SOCA MEWA template for the census information. And renewal is required if you are bringing a current level funded group to us. We would require the renewal and any claims information that you have. The quoting should be available online. It's always the beginning of October, but we are there, so you're good to go on that. For technical issues or questions, should you be sent to the software, use the phone number or the excuse me. This is a list of common reasons why a group is returned for additional information. You'll notice the turnaround time does vary, about 3.5 days. So clean submissions obviously go a lot smoother and a lot faster. So just really the majority of these are just incomplete information. So make sure that employer applications are complete, EFT forms are complete. The census matches the quote that's being sent in. Necessary documents are uploaded as they are supposed to be. Address clarification. A lot of times it might have a number without a street or a street without a number. Just make sure those are very, complete as well. Chamber membership is required. Our chamber membership cannot be a screenshot of a chamber. It has to be written from the chamber, verifying that you're a chamber member, either a letter or an email, or proof of payment for chamber membership or renewal. So those are the only things that we accept as chamber proof. And then make sure that the broker that is writing the business is licensed and appointed with us, because we obviously can't move forward with that. That takes care of our presentation today. If you had any questions, please put those in the chat. We will answer what we can. If there's any that we need to take back, we will make sure that that's, completed. But we do appreciate your time, and anything that we can do, please reach out to your broker advisor, let them know what you need, and we will help them in any way.
So it does look like we have some questions. So is the renewal required for census underwriting for SOCA? Will you quote virgin groups with a census if 10 or more are enrolled? So no.
Yes. I'm sorry, I can
go ahead.
respond to that. So yes, we can quote virgin groups using census underwriting.
And the renewal is not required to answer that.
We require a renewal only for Anthem balance funding. It's required for SOCA MEWA.
That is the only question right now. Can hang out for a minute and see if there's any more, but that looks like it's it. Anyone can direct questions to me too. My contact information is on there as well. So I think that's it. Doesn't look like there's any more questions. So thank you, everyone.
All
Thank you,
right.
Anthem.
Thank you.
So much.